Hi, I'm Michael with 45 Urgent Care with your tip of the week. This week I'm going to be talking to you about Epistaxis, or most commonly known as nosebleeds. Now, nosebleeds is a condition that affects many Americans. A lot of times happening a little bit more in low humidity areas, as well as during the winter months when the nasal passages get dry and end up cracking and having bleeding. Now, usually when patients first have this condition, it can be caused from things like I spoke of, having a dry nose just due to the environment, as well as having allergic rhinitis or nasal infections, as well as just trauma from different things that happens to the nose. Now, usually the initial treatment that I have patients doing at home when they present with a nosebleed is just by compressing the nares. As they compress the nasal passages, if they hold this for up to 15 minutes, a lot of times, in most cases, this will stop the nosebleed. Now, if bleeding is not stopped, you need to be seen by your medical professional. Your medical professional will then use usually a vasoconstrictive substance to be able to stop the bleeding and then be able to visualize the nasal cavity. If the source of bleeding is recognized and we see an area that has become opened up and is coursing blood, then we will proceed using a substance to actually cauterize that the bleeding and stop it. If the provider at that point is still having problems stopping the bleed, we'll then proceed with a procedure where we use a thing called what's called a rhino rocket. Now, these are small nasal type tampons that are inserted in the nose to constrict blood flow, and a lot of times also soaked in a vasoconstrictive substance to help aid in stopping the bleeding. If the nosebleed is a little more posteriorly in location, they will then your professional will go to a procedure where they'll do posterior nasal packing in order to stop this. Now, nasal nosebleeds are very common, especially in patients that are using anticoagulative therapy such as warfarin. Anything that thins the blood prones patients also to become much easier at having these nosebleeds. Now, at that point, if bleeding is controlled and we're having to send patients home using something like the rhino rockets, your provider will also send you home with antibiotics to prevent any secondary infections that can occur sometimes from using packing. Now, it's very important with nosebleeds that if you're running into this and it's becoming more chronic, to seek help from your medical professional. I'm Michael Palmer with 45 Urgent Care with your tip of the week.